March 2015, a decade ago. You, of course, have been involved in Cleveland Clinic Abu Dhabi the whole time. Give us an idea about the vision that inspired this world-class hospital.
Thank you so much. Maybe before I answer the question.
Sorry, the ambient noise here is very loud, so we're going to keep our mics really close to us.
So before I answer the question, maybe I start by saying I stand here filled with pride and admiration, mainly on where the journey started, where we stand today, but also addressing the future going forward. So what started to be a vision, a transformative vision, has really turned CCED to become a beacon of healthcare excellence today as it stands. And as you can imagine, every vision that's mainly transformative presents its own challenges, which we had to deal with throughout the way. But I take it back to the more important point, which is partnership. And because of the partnership we have with Cleveland Clinic in Ohio, they never fell short of committing to these big aspirations to bring us to where we stand today. I don't know how many of the audience know the story of how Cleveland Clinic started. It mainly started with His Highness, our current president, back then being the Crown Prince, speaking to His Excellency Khaldun Al-Mubarak, the CEO of Mubadala, about a patient who had just returned from receiving care from Cleveland Clinic, Ohio. And His Highness asked him, "How was your experience?" His response was, "Clinical care was phenomenal, but being away from my country has added to the stress I was going through." And that touched His Highness, and he looked at Khaldun and said, "We have the brain power, we have the capability, financially or otherwise. Why don't we try to transport that care into Abu Dhabi?" And he pointed on the map at Maria Island and said, "Let's have Cleveland Clinic here." And the rest is history, right? And that solidifies one thing, which is visions in this country are able to be transformed into reality, tangible reality, but disruptive reality too, into where Cleveland Clinic starts today and the way forward.
Absolutely, and you summarize it there so succinctly that perhaps we missed the point, because from His Highness speaking to His Excellency Khaldun, it took 7 years for the vision to become that reality, because there was so much groundwork and there was so much teamwork and partnerships. And I believe you were there when the first patient was seen by Cleveland Clinic Abu Dhabi.
I wasn't an employee of Cleveland Clinic Abu Dhabi yet, but I was an employee of Mubadala Healthcare back then, who was overseeing the project, yes.
So it's fantastic to have that context being said. And of course, Dr. Georges-Pascal Haber, the CEO of Cleveland Clinic Abu Dhabi. Congratulations. I know you've joined a very diverse team in June 2023, just last year. Talk us through the experience of coming to join this world-class institution, because of course you bring your world-class experience. For those who don't know, Dr. Haber is a celebrated surgeon, robotics, peer-reviewed papers numerously. You've led such amazing award-winning teams around the world. So to bring your experience here to Abu Dhabi is such a beautiful synergy.
So first, thank you for your kind words. When if I can just follow on what His Excellency Hasan just said about the bold vision.
Sorry, the ambient noise is quite loud, so we just keep our mics really close.
So, as Hasan said, there was a bold vision that was set, and there was a clear mission for Cleveland Clinic to bring world-class care, not only to Abu Dhabi, but the whole region.
Yes.
After spending 20 years in Ohio at main campus and coming here to Abu Dhabi, I can tell you from personal experience, there is no difference in the care that is being provided in Abu Dhabi compared to the one that is being provided at main campus in Ohio. And let me give you a few examples. The kidney transplant program in Ohio is the #1 ranked program in the whole country, the whole US. If we look at our quality of kidney transplant in Abu Dhabi, it is on par, if not better, than the one in Ohio. So the kidney transplant program in Abu Dhabi is the best compared to any US healthcare system.
I mean, that's remarkable. And we really need to take a highlighter and highlight that point that you're saying in comparison to actually the birthplace, the Cleveland Clinic, Ohio, the Abu Dhabi institution actually, when it comes to kidney transplants, is ranked in a more superior position.
Absolutely. And kidney transplant is only one example. If I can give you, for example, cardiac programs. The cardiac program got 3 stars this year. Less than 5 cardiac centers in the United States are able to get 3 stars. What we were able to build in the last 10 years, it took Cleveland Clinic in Ohio 100 years to build.
That rapid progress, that's remarkable, and it really speaks to the UAE, the speed in which that these milestones are achieved.
Absolutely. The environment, the ecosystem that we have in Abu Dhabi, in the UAE, is second to none. Not only there is a bold vision from the leadership, there is a lot of strategic initiatives. We have committed stakeholders at every level, and we also have forward-thinking regulators. So when you put all this together, it is conducive to do what we're able to do at Cleveland Clinic Abu Dhabi, from providing high quality care to innovating. And I'm proud to say that a lot of the time we innovate at main campus in Ohio, and we bring those innovations to other locations, such as Abu Dhabi. And a lot of examples here, right? Liver transplant, robotic kidney transplant, robotic dual, robotic donor and recipient, and on and on. But for the first time this year, we did the robotic mastectomy, and it was the first in the whole Cleveland Clinic enterprise. So what we're developing now in Abu Dhabi, we're taking it across the pond to the US and London and other locations to be implemented. So the innovation is happening everywhere now.
I think that's a really remarkable point, and we really want to emphasize this. Hasan, you and I have been on stage. I've had the joy of collaborating with the very talented M42 team here a year ago for Arab Health, and then again for the Abu Dhabi Global Healthcare Week. And one of the key points that we were emphasizing throughout those weeks of programming was that in the past, we would look at Western models and bring those examples here to the Middle East, bring those examples of medical innovation to the UAE. But now we are seeing homegrown innovation, homegrown talent, and how that's being exported around the world. That's why stages like this, platforms like this, are so important.
That's very true. And this is, if you recall, what I opened the earlier conversation with, which is this is where the synergy of minds comes, right? This is where the spirit of collaboration comes from. And we're lucky in this country because I always say there is no other country that was able to transform capital into capability like the United Arab Emirates, by attracting the likes of talented individuals like George, but others too. But attracting them is one thing, and giving them the right infrastructure and that oasis of safety and innovation and research is another. For them to flourish, but we're always incentivized to try new things, to be very bold, to be very innovative, which comes and presents its own challenges, right? Because the risk of making mistakes is much higher. I always take the UAE Genome Program as a small example. If for such a program to be launched in the US, you probably would have had more lawyers in the room than scientists, right? But the vision was there in Abu Dhabi to say, let's try and collect that and sequence that million samples in a couple of years. We're close to 800,000 in 2 years now. Unprecedented, which is the largest genome program outside of the US after the Broad Institute. So yes, attracting talent is one thing, but developing local talent is definitely a key fundamental aspect of our leadership. And every conversation that's had is ensuring, that's where the name Mubadala comes from. So Mubadala in English is exchange, right? So they had basically the financial power and capability to exchange that with talent that we did not have back then. Cleveland Clinic partnership is an example of that 15 years ago, right? We did what it took to bring and attract such names that have built experience over the last 100 years, not only to elevate the quality of care, but also develop local talent locally and internationally. So yes, it's at the heart of everything we're doing.
You make so many significant points there, Hasan, and I want to unpack them all. But I do want to give our audience, if you do have any questions, a chance to put some questions to you. Please put your hand up. But Hasan, a couple of points you make there. Converting capital to capability, that really is at the heart of the UAE, as well as at the heart of the M42 model. And you're such a brilliant storyteller we learn from you every time you're on stage, giving us the inspiration behind the word mubadala, exchange. And you've also emphasized this idea of attracting talent, people like Dr. Georges-Pascal Haber and the local talent. I think I'm right in saying that Cleveland Clinic Abu Dhabi have 20% of the workforce is made up of local talent, and you have caregivers, over 5,000 of them, 5,300, I believe at last count. It's an incredibly diverse workforce. Tell us about retaining and attracting the right talent.
I'm going to answer your question about retaining the right talent, but I want to just piggyback on what Hasan just said about Emiratization. And this is, we had the mission to provide the best care, world-class care. We had a mission to do research, but we also had a mission to educate the next generation of caregivers. And it is important to attract local talents. If we look what's happening in Abu Dhabi and the UAE, a lot of the talent is going into finance, into oil industry, not much into healthcare. And it is our duty, our moral obligation to attract the best talent to healthcare if we want to develop world-class healthcare that is founded on local caregivers.
I think that's a really admirable mission. Would you say 20% of the workforce is a good figure?
20% of our caregivers
Yes.
are Emiratis.
Yes, that's a good figure, no?
Including?
Is that a good figure in terms of overall statistics?
No.
No, okay.
We would like to get to 100.
You've heard that, people. Please apply. We want more Emirati caregivers. We want to make it more attractive for them to work, to be trained up, to be retained.
Absolutely. In fact, Cleveland Clinic Abu Dhabi train 50% of the workforce, the healthcare workforce that goes into the Abu Dhabi healthcare ecosystem. So not only we're training to retain this talent, but we're also retaining to contribute to the overall healthcare ecosystem in Abu Dhabi.
And you make a really important point there, Dr. Haber, because you speak about not only training up and therefore sending people into the greater ecosystem, the greater health ecosystem, the UAE, to bring you in, Hasan, on this idea that Cleveland Clinic Abu Dhabi has raised the bar of the health landscape in the UAE, in the region as well. So not only when it comes to the talent that you are training up, but also just raising the bar.
Absolutely, raising the bar when it comes to attracting talent, but developing talent. I look at a UAE national sitting in front of me, Dr. Abir Al-Taneji, right? You can raise your hand. She's one of the examples of the local talent that has been nurtured in Cleveland Clinic Abu Dhabi. But to add to that, and as importantly, today Cleveland Clinic has seen about 1 million patient encounters in 2024, and the number keeps on growing, right? But keeps on growing in a very controlled manner. And about 10,000 patients are international patients. And just to take back Cleveland Clinic to the main mandate or the vision, it was established to treat the population of the United Arab Emirates. And I can assure you of one thing: if tomorrow we decide to open the floodgates slightly wider, we'll probably be attracting multiples of the 10,000 international patients to Cleveland Clinic Abu Dhabi. But we're being very calculated and very thematic as to how we do that, because we do not want to take away slots of UAE nationals being treated at Cleveland Clinic Abu Dhabi. So not only is the bar raised, but now we definitely are very confident to stand up tall and compete with the likes of Cleveland Clinic main campus. And I can tell you from the statistics we see, we compete with them when it comes to quality outcomes, and we outperform them when it comes to quality outcomes. Something I like and appreciate about Dr. Tom, who's the CEO of Cleveland Clinic, is he's actually pushing us to compete with them and to outperform their quality metrics. So yes, we stand here today very proud, but like I said, the journey is not over. It's just about to begin.
Absolutely. Those are really key milestones, and you mentioned them so modestly that I do need to highlight them. Last year, you saw patient encounters surpass 1 million. I mean, that's an incredible number, and the international patient count is increasing. And as you say, it's a case of having that in a controlled fashion to ensure that the care here is really prioritized. Dr. Haber, how closely is innovation and technology tied to the future vision of Cleveland Clinic Abu Dhabi? We're celebrating great milestones, but looking ahead, you, of course, are a celebrated surgeon, first of a kind when it comes to robotics, and you've performed several firsts, especially in scar-free kidney transplants. So of course you are very astute to answer this question for us. Innovation, technology, how are they at the heart of the vision going ahead?
So, in fact, technology have always played a big role in healthcare, and innovation have always been part of the DNA of Cleveland Clinic. In general, for the last 100 years, right? From pioneering kidney transplant to cabbage to catheters and so on. So this is what Cleveland Clinic do the best, is innovate. What we've seen over the last 100 years is nothing compared to what we're going to be seeing in the next 3 to 5 years. What we're seeing right now with all the new technologies such as AI and robotics is going to accelerate the rate of innovation. And it is going to play a huge role. Because until now, we've always looked at healthcare and medicine as a science and an art. Going forward with AI, we can look at it as an engineering problem. And once it's an engineering problem, now we can look for solutions. And this is what's exciting. And I couldn't be more excited about what's going to come in the next few years.
I can see the sparkle in your eyes when you talk about being excited about the future vision. And that's a really beautiful way that you put it, that you say that healthcare was seen as a science and an art, but now it's an engineering scenario where you can actually come up with the solutions. A really key way of thinking. I did promise to open it up to the audience. Does anybody have any burning questions? These are amazing speakers. You don't often get a chance to put them in the hot seat. So please don't be shy. I have more questions, clearly, so I'll continue. But indicate if you do want to ask, and especially our wonderful Emirati sister, if you want to say anything, our celebrated audience member here. May I put a thought experiment to you, Hasan, because you do like me to put you in the hot seat. If you had to go back 10 years, what would you do differently? What are some of the things you've learned about the healthcare ecosystem here in the region, or perhaps about the journey? What would you have done differently?
So first of all, the hot seat is usually in the center and it's not my hot seat.
We'll swap you round.
What was the question?
What would you have done differently, reflecting on the journey of the last 10 years?
Not much, to be honest. And looking at the outcome of what we have done over the last 10 years, not much. But, we're always hard on ourselves when it comes to outcomes, given we are a country of perfection, a country that always wants the best for its people. We're always eager to do things much faster, right? But that comes with its own challenges, with its own risks. But we wouldn't have done it much more differently other than what we have done, to be honest.
Well, that's really profound to hear you say that, because it means that given your experience here in the region, your experience of being the chairman and your insight in terms of the journey, to hear that, I think that's really comforting for the rest of us to know that it's in good hands, and that right from the staff level to the leadership, that the vision it feels like it's been executed well.
You know, when you say in good hands, allow me to disagree with that for a second, respectfully, only because I'm one person, right? And I cannot do this without the team. And I always say, the higher you rise, the more challenging it becomes, and the lonelier you are. And something I've learned, unfortunately, the hard way over the years is leadership is not about being in charge of people, but being in their charge, right? And there is a profound difference between both. But what leadership is all about is how do we enable any environment we exist in to ensure that people actually develop and fly. I'll use Dana as an example. I've worked with Dana for the last 10 years. And I would say she's the only constant in Cleveland Clinic Abu Dhabi, dealing with the most difficult personalities you can ever imagine, right? So I always say doctors always see themselves on a pedestal, talk about surgeons, right? But I don't know how she did it. She has done a phenomenal job coping with George's predecessors, but now having to cope with George too, which is also not easy. That being said, we will, like I said, this is only the beginning. We continue to evolve, to innovate, and to push boundaries. And it's going to be a challenge, but a challenge we have committed to take on board.
Well, we appreciate you being candid and giving your insight, and I will certainly be speaking to you later to be hearing about some of these stories. And I think this is why these types of events are so wonderful. We can read about the experience of Cleveland Clinic Abu Dhabi. You can read a blog, you can watch a video, but to have this level of interaction with leaders at the top of their game, to speak so openly, and also to celebrate the staff, the people behind it, to bring in the whole team, I think that's what makes events like this priceless. Now, we've only got a few minutes on the clock. May I ask for a last call to action? Where do you see the vision going forwards, and where would you see that maybe partnerships and collaborations, what would you be looking for? We have many big players here at the Arab Health 2025. People are listening into this conversation. What would you say is a good way to embrace everyone and bring them on the journey with you, Dr. Haber?
So in fact, what we're seeing across the world, especially in the US and in Europe, in terms of challenges for healthcare, I mean, we've seen what's happening with the NHS, we've seen what's happening between insurance companies and healthcare providers in the US. Healthcare is facing big challenges. However, in Abu Dhabi, in the UAE, there is a huge investment into healthcare that we're not seeing anywhere across the world. This region is positioned in a way that if we continue our strategic initiatives and our right investment, we can position Abu Dhabi and the UAE as the hub for healthcare, not only in the region, but in the whole world. I see this region becoming the pioneer in healthcare innovation, in defining how healthcare is going to be in the future, and in fact, in creating the future of healthcare.
I think that's a really beautiful vision, and I'm going to give Hasan the final word when we come to looking ahead. So we've celebrated the last 10 years, the milestone that has been achieved collectively, but looking ahead to the next 10 years, what would be your call to action, your main mission going ahead?
Again, you know, my predecessor, His Excellency Waleed Al-Mahiri, honestly is the person who started this commitment at Cleveland Clinic Abu Dhabi, and I'm only here to continue what he has built. But everything we'll have to do going forward has to be at a global competitive stage, right? We don't compete locally, we don't compete regionally, but rather compete globally. And everything we will do will be obviously driven and enabled by technology. But the one thing for Cleveland Clinic Abu Dhabi mainly is research and education as we go, because that will be a very important pillar for us to focus on to continue to nurture what we have achieved so far.
So the vision going ahead is about competing globally and also increasing the research capability.
Absolutely.
And as you said before, ensuring that it is a collective team effort. These are great points to end on. And gentlemen, I know that you have a very busy schedule, so we shall release you. But my audience, please give them a big round of applause for this very special session.